Hi, my name is Kristen Kilpatrick, and I am a Maryville University family nurse practitioner student, and this is my eyes, ears, nose, and throat examination. This is Lori, and she agreed to be my patient today, and we already met each other. We did the Snellen chart and the Rosenbaum chart before this video, and she scored a 20 out of 20 for far vision on the Snellen chart in both eyes, and she also scored a 20 out of 20 on the Rosenbaum chart for near vision in both eyes, which are all normal findings. Next, I'm going to just look at the eyes. Go ahead and close your eyes. I'm going to palpate for any nodules, any swelling, any tenderness. I don't see any discharge. I'm looking at the eyebrows, and they both extend to the temporal canthus. The eyebrow distribution is normal, and there are no lesions noted, no flakiness. Her eyelash distribution is also normal in both eyes. I'm going to look at the structures of the eye. I see the cornea is clear. I see that both irides are a brown color bilaterally. And I do not notice any foreign bodies, any abnormal findings when just looking at the eye. Next, I'm going to get my pen light, and I'm going to inspect the sclera and the conjunctiva. All right, go ahead and look up. All right, the sclera is white with blood vessels noted, and the conjunctiva is pink in the right eye. I do not see any foreign bodies. I do not see any discharge, and it is normal. Go ahead in the left eye. I see blood vessels noted. The conjunctiva is a pink color, no discharge, and no tenderness is noted there either. I'm going to also assess the pupils at this time. Both of her pupils are about a 3 millimeters. And they are round. I'm going to shine a light in them on the right eye, and the right eye constricts. So I'm going to go ahead and look at the left eye now. All right, and the left eye constricted also. So I'm going to constrict the left eye, look at the left eye. All right, it constricted to light. And do the left eye look at the right eye. All right, and it constricted to light also. So that is a normal finding. Go ahead and stare straight ahead and tell me when you can't see my fingers anymore. Stare straight ahead.
Yeah.
All right, and that is a normal finding as far as her peripheral vision. Next, I'm going to do the 6 cardinal fields of gaze with you. Follow my pen light with your eyes and keep your head still. Up, down, back to the middle, across the way, go back up, down, back to the middle. All right, and her pupils, she did follow the pen light, and her pupils did react whenever I brought the pen light close to her face, which is a normal reaction. I'm looking at the lacrimal glands also. There is no excess discharge. They are moist and pink, and there are no abnormalities noted with that. I'm going to go ahead and do the corneal sensitivity test with the cotton ball to see if she blinks. All right, and she blinked in both eyes whenever I introduced the cotton ball to her eye, which is good. Next, I am going to just go ahead and have your eyes open and close them. Open them again. All right, I don't see any fasciculations, no tremors, no swelling, no discharge, nothing abnormal at this time. I'm going to do the cover-uncover test to look for any drifts in the lateral or nasal way. Go ahead and look straight ahead. I'm looking at the right eye. No drift noted. Cover the right eye, look at the left. No drift noted. Cover the left, look at the left eye. No drift noted. Cover the left, look at the right eye. No drift is noted, which is a good finding. This is a normal finding. All right, next I am going to go ahead and use my ophthalmoscope. I'm going to look at her left eye with my left hand and brace my right hand on her face. First, I'm going to introduce the light. I see the lens, the red reflex. Dial down, see the retina, and it's an orangish color. I see the blood vessels. Stare at the light. I see the macula, and I see the optic disc also. And there was also depth to the anterior chamber. I'm going to do the same with the right eye and the right hand. And I'm going to brace my left hand on her face. I am going to go ahead and introduce it. I see the lens, clarity, red reflex, dial down. I see the retina, It's an orangish color. Look straight here at the light. See the macula and the optic discs and some blood vessels noted. And there's also depth to the anterior chamber. And that concludes the eye exam. Next, I'm going to move on to the ears. First, I will just inspect the ears. They look symmetrical to each other. They are at a good level with the top of the ears right in line with the eyes. I don't see any lesions, any redness. Is there any tenderness?
No.
Okay. Checking for tenderness all over. I don't see any discharge at this time. No cerumen on the outside. She does have earrings present. I am going to use the otoscope with my right hand to look in her right ear and look at the external canal, and then I will look at the tympanic membrane also. All right. So I bring it in the ear. Okay, in the external canal, it is pink and normal ethnicity. Some hairs are noted, no cerumen. The tympanic membrane is a pearly gray, and the bony prominences were noted. There was no perforation, no fluid, no redness, and the bony prominences were also noted. So I'm going to go ahead and look at the left ear with my left hand. All right. I see the tympanic membrane's a pearly gray, and the bony prominence is noted. There is no cerumen. The external canal has no abnormalities, no foreign objects, and there is no fluid noted in the ear also. And I've been assessing her hearing since we started this examination. She has been able to answer my questions appropriately. And next I'm going to do the Weber test on her with my tuning fork. So tell me if you can hear this the same in both ears.
Yeah.
Yes, okay, good. And that is a normal finding. I'm going to do the Renee test with you also. So I'm going to strike this tuning fork and put it on your mastoid process behind your right ear. Tell me when you cannot hear it anymore, and then I'll bring it in front of your ear and tell me when you cannot hear it anymore also.
No.
All right, and that was a normal finding. The air conduction was twice as long as bone conduction. I will do the same for the left ear.
No. No.
All right, and that was a normal finding also. So good. I'm going to do the whisper test. If you cover your left ear, I'm going to whisper some stuff in your right ear.
4, 5, 6.
Okay, do the same for the opposite.
7, 8, 9.
All right, and that was correct. And so that concludes our hearing exam, our ear exam. So now we are on to the nose. So first I'm just going to look at the nose. I'm going to palpate the sinuses, the frontal sinus for tenderness, and the maxillary sinus for tenderness. Any tenderness noted? All right, I'm going to look at the nose, feel for any bony abnormalities, cartilage abnormalities. I don't see any lesions. No tenderness was noted. There's no redness, no obvious ulcerations or anything like that. Next, I'm going to look at the nose. Go ahead and tilt your head up. All right, she has some hairs noted, a little bit of clear discharge from allergies, and otherwise it is a pink color, and no abnormalities noted, no foreign objects, no ulcerations or anything like that. All right, and next I'm going to do the mouth and throat examination. So I'm going to look at the lips, and I'm going to palpate them. They are a pink color. No tenderness, no ulcerations, no crusts, nothing noted like that. That is abnormal. I'm going to go ahead and look inside the mouth. Go ahead and stick out your tongue. I'm looking at the teeth. Seems like she has some fillings. I see them. All of her teeth are there though. All of the gums are pink, and the soft and hard palates are pink. The tongue is also pink with no redness. Go ahead and stick up your tongue. Stick it up. Okay. The frenulum is intact. Stick it to the left. All right. No ulcerations. Stick it to the right. No ulcerations. And that was checking for any sort of cancer. Go ahead and stick out your tongue and say ah. All right. Say ah again. All right. The uvula rose with the palate evenly and symmetrically. And the posterior oropharynx was a pink. She does not have any tonsils. She had a tonsillectomy whenever she was a child. And lastly, I will go ahead and assess the gag reflex. All right. And she does have a positive gag reflex. And this concludes our the eyes, ears, nose, and throat examination. Thank you for being my patient today.